Good afternoon, and thanks for joining us for today's brand new Healthline 3. I'm Courtney Butts. Healthline 3 is where we like to focus on ways to live a healthier, happier, and pain-free life. We'll be taking your calls and answering your questions live in the studio today. We'll be opening those phone lines soon, but as a reminder, make sure you're in a quiet room when you call with your TV turned all the way down so that we can hear your question. That number to call is 318-219-4569. It'll be on your screen soon. And today we are talking all about the important things you need to know about skin cancer and preventing your risk. And joining me to talk about this is dermatologist Sarah Glorioso with Arklatex Dermatology. Thanks for joining me today.
Thanks for having me.
Fun fact, she is my dermatologist, so this is really fun to have you in here. Awesome. So we talked a little bit in our midday newscast about skin cancer, and so it's summertime, people are outside a little bit more, so we are already increasing our risk for skin cancer. So what are the big ones that we need to worry about, types of skin cancer?
So the malignant melanoma is the deadliest form of skin cancer. It's the one that's darker. Generally, we call it the A, B, C, D, E's of melanoma. And then another major type of skin cancer is squamous cell carcinoma. It's more red with thicker scale. It can occur on the head and neck a lot in very sun-exposed regions. And then basal cell carcinoma we see all the time, especially where we live in the South with people working outside, playing outside. And that's the one that comes up kind of as a little bump, may bleed, or sometimes even ulcerates. So we see all three of the major types of skin cancer in this area, especially the squamous cells and basal cells, just because of where we live.
Right, yeah, and we're it's so hot out here, so it's like you don't want to wear a jacket outside. Right. Okay, so some skin cancers are obviously more serious than others, but you mentioned that the basal and the squamous are ones that you typically have when you're outside or exposed to the sun.
So you can get all the major types of skin cancer from sun exposure. That chronic day-to-day sun exposure, though, we do see a lot more of the squamous cells and basal cells. Melanomas do occur in areas of bad sunburns or people with a high tanning bed history. So sun definitely plays a role in all three, and so we want to protect ourselves against the worst forms and the more common forms.
Yeah, okay. And so since you mentioned tanning beds, so I feel like a lot of times people think, oh, well, it's not sunshine, you know, you're not out in the sun, so it should be better for me. It's probably not true.
Opposite, we would say. You know, it's actually worse. So if you really love the sun and want to get a little bit of sun, we would say at least get the natural sun from, you know, get those vitamin D rays. We still encourage sunscreen and sun protection when you're out there. The tanning bed, of course, for us is a big no. And, you know, why would you pay to go get radiated in the sun like that? I mean, in a tanning bed with, you know, unnatural tan. And so people think, oh, I'm going to go get my base tan before I go get out in the sun. That's just not what we recommend. We do not recommend tanning bed use.
Okay, yeah. Good advice there. Okay, and so you mentioned this earlier with melanoma, it being the deadliest form of cancer, skin cancer. So you mentioned something about the ABCDEs. So this is something that you're referring to as far as like what the bump or lesion on your skin will look like over time? So
yeah, the ABCDEs are an easy, you know, way to try to remember. A is an asymmetric lesion. It doesn't look you know, the same on both sides. B, an irregular border. C, color, a lot of dark black, sometimes red, blue, just a funny looking color. D, diameter, so something bigger than 6 millimeters, which is about bigger than a pencil head eraser. And then E is evolving, so something changing quickly. So that's a descriptor of the lesion itself.
Gotcha. Okay. Yeah, and so that's something that if you notice a bump or you know, if you notice something, when should you worry? I guess once you get to any of those phases?
Any of those, if you haven't noticed it before, it's something new, something that's standing out from the crowd. We call it the ugly duckling sign. You may have a lot of like small brown moles, but then all of a sudden you've got one that looks different.
Okay.
You want to give the dermatologist a call. They need to lay eyes on it, possibly biopsy it. If you don't have a dermatologist, your family practitioner or primary care doctor may be able to direct you in the right way.
Right. Okay.
It's always better to be safe than sorry.
Absolutely.
Yeah.
Yeah. So let's say someone doesn't have, or they might see their primary care, but maybe they want to get established with a dermatologist, to give that expert eye. How often do you typically check on those bumps or moles?
So I like to do an annual total body skin check for patients. Now, if they have a history of skin cancer, of course, it may be bumped up to every 3 months or every 6 months, depending on the type of cancer they had. And I'm really into also encouraging patients to do self-exams. So look at your body, monthly, and if you notice something out of the ordinary, that's a time to give yourself a call. I mean, patients are able to find a lot of the issues themselves because they know what they have had and what's new.
Right, and how it's changed.
I mean, being aware of your skin is so important.
Right. Yeah, that's really important too. Yeah. And so when you are out in the sun, can the sun kind of make, or you mentioned melanoma can actually come about from sun exposure too. So yeah, if you want to talk a little bit more about melanoma and how sun exposure can actually, is that with a specific mole that would make it worse? Okay.
Good question. So you can get a melanoma in a mole that it can come up in an existing mole or it can come up brand new.
Gotcha.
A sunburn can increase your risk to change, either change an established mole into a skin cancer or just get a brand new lesion. So those are all different.
And we've got our graphic
options
up here that you were talking
so those
about.
are the ABCDEs. You can see what we're talking about with the different changing of the lesions.
Right.
And so those are things you can look for at home, and then we look at them in the office and check for similar things. And if we're at all worried, we do what we call a shave biopsy. It's an easy in-office procedure where we numb it right then and there in the office. We don't make you come back, and but we do it right then, and we do a shave biopsy. Of course, if you do get a diagnosis of melanoma, squamous cell, or basal cell, then you're set up for another procedure generally to then handle the lesion,
Gotcha.
to treat it.
Okay.
And depending on the type of skin cancer, depends on the treatment.
Yeah, and so when you see these abnormal changes that you see here on our screen, how or when do you think, when it's here, A, B, C, D, or E, or at any of the stages, is it at a point that it's already progressed to cancer at that time, or does that make sense?
Yeah, so it's hard to know because you have to. Every patient's skin is different. So you could come in and it has changed, and it could be what we call an atypical mole. So it hadn't developed a full-blown skin cancer, but it was on its way, like a little we call them precancers or precancerous lesions. So you can catch it, progressing towards, hopefully we get it at that stage before we get it at a full-blown melanoma. And the other two types, you can catch them early. It's better to catch a small squamous cell or a small basal cell versus a large one, because then your excision is smaller. The scar you get is smaller. Squamous cells can get into the nerves and the lymph nodes, especially if they're on that head and neck where we have a large blood supply of nerves and blood vessels. And so you want to catch them early so that they don't get in and possibly spread.
Right.
So all the skin cancers have their concern.
Right.
Melanoma, of course, is the one that you hear about, killing younger people, but squamous cells and basal cells are not to be taken lightly either.
Do you recommend people that may have more moles on their body to just have them removed preemptively?
We don't take off a bunch of benign lesions just because that would be a little invasive. However, people with extra moles should get more frequent skin checks.
Okay.
There are some syndromes where people have more than 50 moles, or there's different syndromes where you should get maybe your skin checked more frequently if you feel like you have more moles than the average person. But we don't cut off benign moles just to take them off generally, unless they aggravate people. Like I have men, that there's some in their face, on their beard area that they cut shaving, and so we'll take those off for them, or, in the scalp. Of course, moles on the hands and feet we pay special attention to as well. So there's, depending on the area of the body, we we'll look at the lesion and decide if we need to take it off.
And depending on how often it's exposed to the sun.
That's
I'm
right.
Sure.
Yeah.
Gotcha. Okay, learning so much here. I love it. So let's say you were diagnosed with cancer, or I'm diagnosed with melanoma. What are the next steps as far as treatment? I know you mentioned maybe removing it, but at that point, what's next?
Okay, so if you have a superficial melanoma, one that does not go down deep, the dermatologist can generally handle it with an excision with certain margins. If it has gone down deeper into the skin, then we send you to what we call a surgical oncologist, and this general surgeon will do it deeper, wider, and sometimes they'll need to do what we call a sentinel lymph node biopsy, where they check that closest lymph node to make sure the melanoma has not already gone into the lymphatic system. Of course, if it's really progressed, then you have to get an oncologist involved, and there's different forms of immunotherapy or chemotherapy, but that's when they're way, way more advanced. We're hoping that we catch them early so they can just be handled with an excision.
Right. And so the melanoma, is that the one that typically will spread more so than the squamous or the basal?
That's the one that spreads the most quickly, and it always can catch people by surprise.
Right.
That how fast it can progress.
Yeah.
So the other two are a little bit more slow growing. Basal cell especially is a little bit more slow growing. Very rarely metastasizes or spreads, but can just grow and grow and grow in that area.
Okay.
Squamous cell, like I kind of mentioned earlier, does have likes the nerves. It likes to get in the nerves and spread, or get in the lymph nodes, or get in the blood vessels and spread a little bit too. So we don't take those lightly either, especially in this area.
Right.
One on the nose or ear, scalp, those lesions we have to be very careful with.
Okay. So let's say, we know SPF is important, right?
Right.
But let's say for someone who maybe works outside, or, they're constantly outside, they can't really, maybe the first line would be just to spend less time outside to prevent your risk.
Right.
But let's say they can't, maybe they work in construction or something, or outdoors a lot. What would you suggest?
So that is a lot of our patients. They work on the oil rig, they work in construction, there's farmers, post office workers. There's so many people that work outside, so we can't say, well, just don't go outside.
Right.
So we encourage, of course, the wide brim hats, because it's hard to reapply sunscreen constantly, especially if you're sweating or working. So if you're wearing a wide brim hat, wear your sunglasses to protect your eyes. Of course, the long sleeve shirts now that breathe better. There's a lot of different brands now that they're not as hot as they used to be. And then trying to do the sunscreen, I always tell a lot of my outdoor workers, just put one of the sunscreen sticks in your pocket and try to really, reapply when you can, so that you don't get that constant sun beating down on you.
Yeah,
so those are some
advice.
tips that I tell my patients. And then, again, I know it's hot to work outside in long pants, but they've started to make that clothing that does breathe a little better to wear the pants to work.
Right, yeah, so that's good advice there. So let's say someone, is going to the beach, and they're going to be outside a little bit more. I guess being under an umbrella is better than just being out in the sun.
Right.
What type of SPF do you typically recommend?
So for a beach trip, I'm going to say 50 or above, and I really like a sunscreen that contains a physical blocker. The physical blockers are titanium oxide and zinc oxide. You can also incorporate a chemical blocker. Those are some of the ones that sound like oxybenzone or oxytenoxate, but having at least one of those physical blockers in your sunscreen, it makes the sunscreen last a little longer. It doesn't sweat off as much. So you want to have it say broad spectrum. If you're gonna be in the water, you want to try to find one that says water resistant. There is no such thing as waterproof. They had to get rid of that line a while ago, because nothing can completely be waterproof as far as a sunscreen goes. So water resistant, SPF 50 or above, broad spectrum, look for zinc or titanium.
Yeah. Okay. So I'm just thinking of like common patient questions, because this is probably what I would ask you. But Dr. Glorioso, what if I just want to get my vitamin D? What would you recommend?
Okay. So we get that question a lot, and this is kind of my answer for it. Like, if you are getting, you know, a good diet that is high in, you know, fatty, you know, the good fish that has vitamin D, some vitamin D fortified milk, you can get a lot of vitamin D from your diet. If you are vitamin D deficient and your doctor puts you on a vitamin D supplement and you want a little bit of sun vitamin D, don't do it on your face or neck or chest. Maybe get a little bit on your arms and legs when you're going for a walk. That would be kind of my recommendation there.
Okay.
But try not to let it just constantly beat down on this area. But again, you can get a lot of it from a really well-rounded diet.
Right.
As you know, since you're a dietitian too.
Or even taking a supplement.
Yeah, a vitamin D supplement, yeah.
Yeah, okay, good advice. Love that. And yeah, too, you know, for people that may worry about like aging, you know, and wrinkles, sun can just, you know, make that worse. So that's another benefit.
So the sun is the #1 ager. I mean, you can see a grape and a raisin. One's been in the sun.
Yeah.
And I mean, you know, there's all these split face studies where you can see somebody who's driven a truck their entire life and the left side of the face is way worse and they look a lot older on that side. You know, sun exposure, cigarette smoke, I mean, those are things that are going to age you immediately. And so, yeah, people, if you also, so besides the skin cancer reason, the vanity reason, you know, wear your sunscreen to prevent wrinkles, brown spots, that photo aging, I mean, you can spot it a mile away.
Right. Yeah. And, you know, kind of speaking to everyone watching today, you know, okay, yeah, we want to prevent our risk for cancer, but also if you want to like look younger for longer, then just stay out of the sun.
It's the #1 anti-aging product is sunscreen.
Yeah.
You know,
okay. Anything that you recommend for people, you know, like let's say they're getting ready for the day, like a facial, maybe that's a moisturizer and a sunscreen that you would recommend?
So yeah, on day-to-day use, I say you still want to have your sunscreen for running your errands. I mean, I go to work in a building every day and I still have my SPF on, and I do like mine to be a moisturizer with a little tinted sunscreen. I love a tinted sunscreen for my face because it also acts as a little bit of makeup.
Right.
And so do that daily. In your like day-to-day routine. And men, you know, men need it too. You know, women are more used to it because we're used to putting a little makeup on, but doing a lightweight moisturizer with sunscreen, even for our male patients daily, a 30 or above. And then of course, if you're out in the sun more, you want that 50 or above.
Yeah, okay.
Yeah.
And like if you're going on that beach trip or anything like that.
Or golfer or tennis players. I mean, just around Shreveport Bossier, the amount of sun we get with our recreational activities, going out to Cross Lake. I mean.
Oh my goodness, yeah, I would get on to my husband every time we go play golf and it would just be sunburn on his neck. Yeah. So that's good advice for sure. Okay, so we talked a little bit about treatment options, and you know, we talked about like that. It ranges from an excision all the way to maybe even chemotherapy. So we definitely don't want to get to a point where it's like stage 4, stage 5. Exactly. You know, that's really scary. So we talked about prevention tactics. Will it reoccur?
So any cancer of any type has the potential to reoccur. You know, cure rates are very good for surgery of squamous cell and basal cell. You know, we also have to do some radiation therapy for certain squamous cells and basal cells. Melanoma cure rates are generally good, but any skin cancer can recur. I think that's any cancer in general. And so, of course, you're going to have more frequent visits once you've been diagnosed with one. Yeah.
Okay. Is there any type of, you know, with colon cancer, you've got the colonoscopy. Is there any kind of preventative measure or screening that you can do with skin cancer?
You know, at about age 40, we start saying you need to do an annual, what we call total body skin exam, where we give you a gown, you know, we have you undressed, and we you know, we check you head to toe for moles, and we also are checking for rough, scaly spots that could be precancers or basal cells or squamous cells. Some patients want to just do an upper body skin check, which we understand, and we'll do that. And then we have some that come in and just say, I just want to check these certain moles, and we're okay with that too. Yeah. We love the total body skin check. So that would be our the screening colonoscopy, the screening mammogram. Ours is we lay eyes on you, annually.
Right.
So
that's good. And especially, I think, you can't see like if there's one on your back too. So that's important.
So the backs, backs in men, we get a lot of skin cancers that they had no idea were even there. The backs of the legs in women, they had no idea they were even there. So it is good. Try to look at your back and your back of your legs in the mirror. But again, that's why you come in to let us check. Scalps, our hairdresser friends help us sometimes find lesions there, but we also do go through your scalp because there's moles up there you may not be aware of.
Yeah, and I feel like everybody's been there at one point. They've burned their scalp. It's the last thing that you think about.
So women with the part, I always say spray your sunscreen on your part line or wear your hair straight back or wear a hat.
Right.
And then men are, generally better about wearing their baseball hats, but a lot of them wear the baseball hats that have the little breathable holes and the sun is still getting through, especially if they don't have hair, because there's a lot of male patients that have lost some of their hair, my husband included. And so, you want to be careful with getting a burn on your scalp. And then the wide brim is our favorite because you're protecting the ears.
Yeah. Okay. And so you mentioned earlier people, how sun can age you. And I think a lot of times people don't think about when you're driving in your car on that left side, especially if you're, the driver or the passenger side. Does that actually make a difference when you're driving?
Definitely makes a difference. I mean, now there's some tinted windows that help protect some, but what we generally say is car glass is only really protecting you against UVB rays. So the UVA rays, the aging rays, and it can also cause skin cancer, can come in through the car window. So for when I'm on road trips and I'm driving, I've got my little sunscreen on my hands because I don't want my hands to look older. I don't want a skin cancer on my hands. So if you're driving 10 and 2, you want your sunscreen on your hands. Try to wear your sunscreen on your face. I even do my neck and chest because I don't want that to get a lot of spots or a skin cancer. So it's definitely a thing on long road trips to protect yourself from the sun too, especially that front, because you can't tint your front glass really. You can tint the side a little bit.
Okay, so now I have a very kind of odd question. So, with I feel like there's some studies out that exposure to sun, or at least morning sun when you are on the way to work or whatever, can help with your circadian rhythm. So what do you think about that?
Again, a little bit of sun exposure, being responsible, I think is okay, but you can still get sun, a little sun is still coming through even with your sunscreen on.
Right, okay.
And so, I'm not saying to be a vampire and never go out.
Yeah, right.
And sleep is so important for everything. So I do understand what you're saying. But
morning sun's way different than afternoon sun too.
Right.
So, it can kind of be different with the heat index, and how hot it is. So
that 12 o'clock to about 4 or 5 is just like brutally. I mean, it could be miserable. So like you're saying, like you're on the way to work sun or your morning walk, maybe a little better than heading out there at 2.
And spending just a couple minutes, even just a couple minutes in the sun, especially when the heat index is, or the UV index is like 11 or something crazy, or extreme, you might want to avoid the sun. Yeah. And I like that you're saying that there is some balance to that too, but overall you want to be really smart about protecting your skin. Yeah. Okay.
I mean, I went to the beach this summer with my kids because my kids love it. And yes, I'm under the umbrella. When I'm in the water, I try to wear my, SPF clothing. But am I getting a little bit of sun even through my sunscreen? Of course, you know.
Yeah.
So
it's pretty hard to do in Louisiana when it's
and
just
especially if you have children and you're at the baseball park or
Right.
wherever you're going. Or the golf course with your husband.
But at the end of the day, you can still wear that SPF 50 and keep it in your pocket, like you were saying, with the little stick. And having these other, strategies to make sure you're being protected.
Yeah, and having different sunscreens, like a different one for your face, and then, like you're saying, the stick for reapplication. You may need more than just one at your house. My face sunscreen is going to be different than what I'm applying to my hands and all of that.
Okay.
So
that's good.
when you're shopping for different sunscreens, keep that in mind. And those sticks really are convenient.
Yeah, and I feel like the sprays, to me, I miss a spot always.
You miss a spot, and a lot of those are chemical sunscreens. You can find sprays that have some zinc oxide in them. So the sprays, I see people doing the spray like this on the face, and I'm like, that's really not getting the job done. Why don't you do a nice cream at least on your face? And if you want to do this spray on your body, okay, but maybe at least with the cream you can see that you've applied it thoroughly.
Yeah,
you know?
that's true. Yeah, because
So-
it goes on usually pretty thick. You can see it, and then you got to really,
Right.
make sure it's distributed. So, okay, good. So we've got a couple minutes left, but let's say someone is wanting to establish care with you. Where can we find you? Are you accepting patients right now?
We are accepting new patients. Arclatex Dermatology, we have offices at Willis Knighton Bossier and Willis Knighton Piermont. So we have 2 locations, which is convenient, and we have a website. You can get our number, but myself and my 3 partners are all accepting new patients, and we can get patients in for skin checks. And so you can call our Bossier office 212-7800 or our Shreveport office 212-3440. But arclatexdermatology.com has all of our information, and you can even make online appointments now.
Okay,
so that's nice.
easy.
Yeah.
Okay, so are you booked out pretty far?
We're booking out far just because this is that time of year people are aware of their skin and know they need to get skin checks. But we definitely have room. This is also high rash time with poison ivy and that sort of thing. So there's just a lot going on, and kids are out for summer and want their acne treated and their warts treated. So this is definitely a busy dermatology time, but we do have room for new patients. So,
Okay.
Yeah.
So insurance, you accept insurance as well?
Oh yeah, we accept insurance, and if you don't have insurance, we do have a cash pay or self-pay program.
Oh, nice.
But we accept all the major types of insurance, but of course you want to call to double check.
Yeah. Okay, and so let's say you, so going back to the skin cancer real quick, I had a question and it just came back to me. Let's say somebody in there had a family history of skin cancer, and you said 40 is when you would recommend the annual checks. But if, let's say my mom had skin cancer or something, would I need to come in sooner?
Yeah, so if there's a family history, you may need to come in sooner. If you've noticed something, come in sooner. If your regular doctor noticed something, come in sooner. So I mean, that's just kind of a general number. But yeah, if you have especially if you have a family history of melanoma, you want to come in probably earlier for your total body skin check.
Yeah.
And then the biggest thing is if you notice anything out of the ordinary or something's not acting right, something is bleeding, like bug bites heal, pimples heal, but a lesion that comes up that doesn't heal, that's needs to be addressed. That's not normal. The face, we get the basal cells, they're like, I've had this spot, it's just a bump, but it hasn't been healing. That's something we need to address.
Yeah, okay. So earlier in our midday newscast, you mentioned there's no safe way to tan. Right. But Dr. Glorioso, I want that nice summer glow. What would you recommend?
Spray tan, self-tanner, bronzer. There's a lot of options out there. Okay. Again, I know people are going to get a little bit of summer sun, but you just don't need to be laying out there and baking.
Yes. Yeah.
It takes its toll on your skin. The brown spots that have the potential to turn into skin cancer.
Right.
So just be smart about it.
Right.
Yeah, and if you have a big event, the spray tans do really well, and just the self tanners you can buy at the drugstore.
Yeah, any brand that you typically recommend?
One that's really affordable is just the Jergens.
Okay.
Jergens lotion. We have the higher end ones like at Ulta, like the Saint Tropez and other things you can buy, but you don't have to break the bank, to get yourself a safe tan.
I love that. Yeah, and I'm a big believer in self tan.
Right.
And the Jergens, at least you can do that maybe as your nightly routine, and that could be your summer glow for the.
There you go.
For the summer. Yeah. Okay. Good advice. I love that. And so stay away from the tanning beds.
Please.
Wear your SPF 50 and above.
That's right.
Right. And if you are going to be out in the sun, just be smart about it. Keep your sunscreen.
Reapply.
How often?
Every hour and a half or so if you're going to be out there. That's, I think, the biggest mistake people make. They put it on, when they head out to the beach at 10, and then at 2 they've forgotten, and they're literally the color of a lobster.
I've done that before.
And then they start blistering, and you you hate that because
Yeah.
it was, they could have prevented it.
Absolutely. Yeah, I've been there before. I think we've all been there.
Yeah, we've all had those days. Yeah.
Awesome.
High school, college.
Yes. Well, thank you so much for being here.
Thanks for having me.
Absolutely.
Yeah.
If you missed this will be on our website at ktbs.com/healthline3. That's all the time that we have, and thanks for joining us.